In this video, we are going to listen Dr. Rock and Rina conversation. Please pay 100% attention so that you will be able to understand. Please avoid all the distraction and focus only on these things. So it will help you to improve your listening and speaking. Remember, practice makes perfect.
Let's get started.
Hello, Rina. How are you feeling today?
Hi Dr. Rock, to be honest, I have been feeling really down lately. I have been having both mental and physical problems and it's been really tough to deal with.
I'm sorry to hear that. Can you tell me more about the specific problems you've been experiencing?
Well, I've been having trouble sleeping, feeling anxious and depressed, and I've been experiencing a lot of physical pain too.
I see. These can all be symptoms of various conditions. I'd like to do a full physical examination and ask you some more questions to help me better understand what might be going on.
That sounds like a good idea. I just really want to get rid of these problems and feel like myself again.
Absolutely, we will work together to get you feeling better. Based on your symptoms, I might recommend some blood tests and imaging studies to help diagnose any underlying physical conditions. Additionally, we can discuss therapy or medication options for your mental health concerns.
Okay, that sounds like a plan. I'm really hopeful that I can find some relief soon.
Great, let's get started with the exams, and then we can discuss next steps from there. Don't hesitate to reach out to me if you have any further concerns or questions along the way.
Thank you, Dr. Rock. I appreciate your help and guidance. It feels good to know that I am taking steps towards feeling better.
Of course, Rina. It's important to take care of both your physical and mental health. It's normal to experience difficulties from time to time, and seeking help is a brave and positive step towards improving your well-being.
Yes, I agree. I've been struggling for a while and I think it's time to address these problems head-on.
That's a healthy attitude, Rina. And remember, recovery is a process, so it's important to be patient with yourself as we work towards finding the best treatment plan for you.
I understand. It's just frustrating to not be able to enjoy my life as I used to. But I'm willing to do whatever it takes to feel better.
I completely understand. We will work together to find the best treatment plan that suits your individual needs. I'm here to support you throughout the process.
Thank you, Dr. Rock. I appreciate your time and care.
You're welcome, Rina. Let's get started with your exams and take it from there.
Sounds good to me, Dr. Rock. I'm ready to get started and find out what's going on with my body and mind.
Great, let's start with a physical exam to check your vital signs and see if there are any physical conditions that may be contributing to your symptoms. After that, we'll discuss some mental health assessments to see if therapy or medication might be helpful for you.
Okay, I'm open to whatever treatment plan you recommend. I just want to feel better.
I understand, Rina. My goal is to help you achieve optimal health and well-being. We'll work together to find the best treatment plan for you, whether that includes medication, therapy, or a combination of both.
Thank you, Dr. Rock. It's a relief to know that I have someone on my side who is dedicated to helping me feel better.
You're welcome, Rina. I'm here to support you every step of the way. Let's get started with your physical exam now, and then we can move on to discussing mental health assessments and treatment options.
Okay, sounds good to me. I'm ready to get started.
Great, let's begin with the physical exam. I'll take your blood pressure, check your heart rate and breathing, and perform some other tests to assess your overall physical health.
Okay, that makes sense. Do you think the physical symptoms I'm experiencing could be related to my mental health concerns?
It's possible. There is a strong link between mental and physical health, and it's not uncommon for physical symptoms to be a manifestation of underlying mental health issues. That's why we need to assess both aspects of your health to get a complete picture of what's going on.
I see. That makes sense. I've just been feeling so overwhelmed lately, and I'm hoping to find some relief from these symptoms.
I understand, Rina. It can be really difficult to deal with physical and mental health issues, especially when they're affecting your daily life. But remember, we're here to help you find the best treatment plan for you.
Thank you, Dr. Rock. I really appreciate your compassion and understanding.
You're welcome, Rina. Let's finish up the physical exam, and then we'll move on to the mental health assessments. Together, we'll come up with a plan to help you feel better.
Okay, that sounds good to me. I'm ready to get started.
Great, let's continue with the physical exam. I'll listen to your heart and lungs, check your reflexes, and perform some other tests to assess your overall physical health.
Okay, I'm ready.
Excellent. Now, let's move on to the mental health assessments. I'll ask you some questions to assess your mental health and determine if therapy or medication might be helpful for you.
All right, I'm ready.
First, I'd like to ask you about your mood. How have you been feeling lately? Have you been experiencing any sadness or hopelessness?
Yes, I have been feeling really down lately. It's been difficult to find joy in things that used to make me happy.
I understand, Rina. That's a common symptom of depression. Have you been experiencing any anxiety or panic attacks as well?
Yes, I have. I often feel anxious and have been experiencing panic attacks more frequently lately.
Okay, thank you for sharing that with me. It's important to get an accurate understanding of what you're experiencing so we can develop the best treatment plan for you. Based on what you've told me, I think it would be helpful for you to start therapy and possibly medication to help manage your symptoms.
Okay, I'm willing to try whatever it takes to feel better.
Great, I'll refer you to a therapist and we can discuss medication options as well. Remember, recovery is a process, and it takes time and effort, but I'm confident that we can get you feeling better.
Please hit the subscribe button and like this video. Thanks for watching.